So my name is Dr. Imaya Balagan. I'm one of the child psychiatrists at Savant Care. I'm going to talk a little bit today about bipolar disorder. Many people have probably seen a lot of bipolar disorder in the media and mentions of it, but I find that there's a lot of misconceptions about it. Now, what is bipolar disorder? Bipolar disorder is a mood disorder, and when I mean mood, I mean the mood state or the mental state people are in most of the time. So the persistent state you're in for most of the time is what I mean by mood. So bipolar disorder is a disturbance in people's moods. So what happens is that they have these episodes where they're at two different poles. So one pole is depression, where your mood is very sad and you don't have any interest, you don't feel like doing anything, you're probably not sleeping or sleeping too much, not eating or eating too much, and if it gets really bad, you're thinking, I don't want to live anymore, I'd rather die. So that's one pole. And the other pole is mania, where it's the other extreme. Your mood is so elevated, you're either so happy or so irritable, and you have so much energy you don't know what to do with it. There's 100,000 thoughts running in your mind. You're speaking too fast, and at some point your thoughts might not even make any sense to the people around you. And what happens is that state leads you to do impulsive things, probably risky things, and that state probably lasts for a few days at a time. So when you combine them, in bipolar disorder you have these episodes where you have either depressive episodes or those manic episodes for a few days at a time, and you might have normal days in between, and sometimes they might come in mixed together. And it has a very, very neurochemical basis. We do know that there are definite changes in your brain when someone goes through this. It's also a little bit genetic, in the sense that if your parent or your grandparents had bipolar disorder, you have a susceptibility to it. You don't necessarily inherit it, but there's a good chance that you might develop it. Bipolar disorder doesn't necessarily mean a person who, say, 1 minute they're happy, 1 minute they're sad, 1 minute they're angry. It's not really that, and which is why I wanted to explain that it's a difference in your mood states and it comes in episodes. Now, we've come a long way from, say, 200 years ago, when we were using, exorcism and bloodletting and leeches to treat mental illnesses. We do know that bipolar disorder can be treated. There are a lot of good medications called mood stabilizers which help with treating bipolar disorder, and counseling and therapy definitely help with guiding people and helping them get through either depressive episodes or other episodes. So if you or someone else has any symptoms similar to what I've described, definitely encourage them to get help.